Go.
Hi guys, my name is Zuri Jimenez. I am doing this presentation video for my communication class. I have a friend here that was volunteering for me to be able to do this video. And you want to tell me your name?
My name is Monica.
Okay. And I'm Zuri. I already said that. Alright, what I'm going to be doing today is just demonstrating a little short video on how to draw labs or draw blood. First thing I'm going to do is obviously verify that my patient is a correct patient, and I want to be as clean as possible, so I'm going to grab some sanitizer and clean my hands. Then I'm going to gather up some Coban, some alcohol wipes, so, my butterfly, which I'm going to use to draw her labs, the tube, the test tube, some cotton balls, and a tourniquet. So I'm gonna start. Are you ready?
Yep.
Okay. And then I put my gloves on. And then I usually ask them like, what's their preferred arm? Some don't care. In this case, since it's closer to my setup, I'm gonna use her right arm. So I'm gonna make sure that I usually put this around her clothing so it doesn't pinch her skin. I make a little like hoop there. I don't know what to call it exactly. And I palpate the vein where I'm going to be going in. And I'm gonna wipe the area. Oops. And I'm gonna do in circular motion, and I can't go to the same area because then that will be contaminated. I will wipe off the alcohol that's left, because then that will burn or possibly contaminate the blood. I'm going to insert the tube into the hub, and I hold the skin down. I'm gonna anchor it, I think it's 45 degrees, straight into the vein. And I have a little flash, which tells me I am good to fill up. Then I finish. I have to remove the tube. Before I remove the needle, I let go of the tourniquet and I'll hold the butterfly with the cotton ball, hold the butterfly, and I'll push it safe. Then I will grab the Coban and wrap her up. Easier said than done, right? But once practice makes perfect, and there you go. Once obviously as soon as I'm done, I'm gonna label the vial, make sure it doesn't get lost. And I think that is all. I hope you guys like my video and it taught you something. Please give me some feedback. Thank you. Hey guys, we're back here in the lab area where I would spend my labs. And after I draw the labs, I come here to a machine that we call a centrifuge. And I have to make sure obviously that it's the correct patient and the correct requisition form, sorry, with the orders that are supposed to go in there. And then we will make sure that the vials are equally full, because if you don't, the centrifuge machine will start shaking because it's not balanced, kind of like a washer. And then place it in here. Then make sure it's sealed correctly, and it's already like programmed for a specific time, but we just press start, we wait for it to spin, and then we put it in a little packing slip, a little biohazards bag, and then we just send it off. And meanwhile, I'm going to show you how to do a urine dip. First, I'm going to grab my machine here. And, sorry. I'm going to show you. Can't really see it good, but there's a machine that I'm going to use here, and I'm going to press start, just kind of give it its time. And I'm gonna place it here. I'm gonna show you steps how to do a urine dip. You get obviously hopefully 10 results. I'm going to open the test and grab a little urine dip stick. It's going to show the colors based on the results. And I have to push the start button, and it's going to start counting down. So once it's getting closer, I will grab my urine dipstick and I'm going to go ahead and dip it here into the urine. I'm going to bring down the excess, make sure there's no extra urine on here, and then I'm going to place it on here on this little space here that's supposed to be in there. Perfect. And it's timing from 20 all the way to, it will count backwards all the way to number 1, and then it will automatically push the test inwards, and it will print a little paper that lets us know the results. So we'll give it some time here, and there you go. The test is ready. Pretty much you can see that there's no infection, and that there's no protein in the urine. So I'm gonna go ahead and press print. I'm gonna toss this in the trash. And everything is perfectly normal on this patient. So that's how I do the urinalysis dip, and pretty much that's it. After I'm done, I will get a little towel and I will clean it. But meanwhile, I'm going to just, what I'm waiting for is the labs to be done spinning. I can put them in the little baggie and send them off. Thank you for your time. I hope that you liked this video, and let me know how I did. Bye.